Hi, Mike.
Uh,
How are you?
hey, good. How are you doing?
I'm good. I'm good. Happy Friday.
Happy Friday to you as well. Hopefully the weather's nice wherever you are today.
It's not bad today, actually. It's pretty nice.
Well, especially after we had another one of these on storms yesterday. How many of these are we going to have this summer?
Well, I mean, they're going to keep happening until we do something about the climate crisis, but that is not this live. So
Yes, exactly.
we could hop right into what is going on with our healthcare system. So I guess for most people in Ontario, we're seeing a lot of, well, across the country. We just did a post on this where we showed the headlines across the country about how bad our supposedly public care, healthcare system, universal, comprehensive, portable, publicly administered healthcare system is existing. And it seems like there are staff shortages across the country. We're seeing um, like closures of like emergency departments, which is like wild to me. I just don't
Hmm.
understand. And I guess I wanted to hear about it from the perspective of like a politician, and you are a politician that we really, I mean, I have a lot of trust and faith in you. So we wanted to sort of invite you to chat with us about what is going on.
Yeah, you know what? So much of what you've said is deeply disturbing. And I noticed when I look at your IG account, it says you're here to disrupt the status quo. And one of the things I find deeply disturbing, the Ford government in particular, has been saying we have to change the status quo in healthcare, which in his case is code for we have to privatize healthcare. And I would say, yes, we need to change the status quo in healthcare, but we need to change the status quo by actually investing and putting the resources into a publicly funded, publicly delivered healthcare system. And it really starts by investing in the people who deliver that care. The quality of care that we receive is directly related to the people who provide the care. And so when you think of nurses, PSWs, and other frontline healthcare workers, they've been overworked and underpaid for many years, but especially over the last 2 years of the pandemic. And in the case of Ontario, where you have legislation in place that caps their wages and benefits at 1%, when inflation is at like 8%, it is essentially a pay cut. And I also
Mhm.
remind people too, it's not only that, a pay cut, but it's also, think of the trauma that so many nurses and other frontline healthcare workers have been through. And maybe they need to access some mental health supports to get through that. And those are capped at 1% as well. And so I don't think we're going to solve the healthcare crisis until we start investing in healthcare workers, which is why myself and other opposition parties and nurses unions and all kind doctors, healthcare advocates, all kinds of people have been saying, at least to the Ontario government, repeal Bill 124
Mhm.
and actually allow nurses and other frontline healthcare workers to negotiate fair wages, fair benefits, and better working conditions. That's where we start with fixing the healthcare system. And I would say in the case of the Ford government, actually spend the money that you've budgeted for healthcare. According to the Financial Accountability Officer in Ontario, the government underspent their healthcare budget by $1.8 billion last year. It's
During
like
a pandemic.
during a pandemic, we're in the worst pandemic we've experienced in 100 years. And the healthcare system is literally collapsing. Emergency rooms are closing, and you underspend your budget by $1.8 billion. Like, who does that? It makes
It's like
absolutely no
almost
sense.
funny if it wasn't so depressing. Like,
Yeah, or so
because it just
tragic.
doesn't make sense. It feels like a plot line from like Veep or like a TV show where we make fun of politicians doing bad things.
Yes.
But then you're like, wait, it's real life.
Yeah.
This is our healthcare system. I like we're watching um him make choices. I mean, across the country we're saying this, but let's stay on Ontario because we've got you today. Um we're seeing across the province so many closures, and like that's gonna impact like middle class, upper middle class, like low income people who need access to like a hospital. Like I don't want to be in a situation where I need to use the Emerge or someone I love needs to use the Emerge, and because of staff shortages that could be prevented, it's shut down, and now my family or myself can't access it. Like what are this is like essential services.
Yeah, it's astounding if you think about it. And I will say, I know you want to talk about this. I'm mostly focused on Ontario, obviously, but I think it is an issue that we need the federal government to step up. and provide increased healthcare transfers to the provinces. So the provinces have the fiscal capacity to invest more in public healthcare. But in the case of Ontario, it's like when the Premier Ford underspends the healthcare budget anyway, it makes it hard for us then to go to the federal government and say, well, hey, provide us with additional funding that we need to keep our emergency rooms open, to provide our nurses with the wage increase they need, to hire additional staff. I mean, it undermines that argument when you don't even spend the budget you have in the first place.
Yeah, it's like he's not, like he hasn't done anything to mitigate this, and now he's just like introducing these sort of like half-assed, like his plan that he put out that's doesn't actually address the foundational root issues that he worsened during his time as premier and continues to. Um, what are we supposed to do? I feel like at a loss, and honestly, the project, whenever we talk about it, we get so many DMs about that. People asking like, so now what? Who do I write? But like, he has a majority government, so it's like, what's the recourse here? Like, what can be done?
I'm going to talk a little bit about what can be done in a second, but I just want to say, what's so infuriating about this is at no time during the provincial election did the premier say, hey, we need to introduce more privatization into healthcare. Not mentioned once by the premier. Here we are 2 months after he's reelected with a majority government, and now all of a sudden, oh, we have to start thinking about privatization. So I think that's just done a complete disservice to Ontarians. And I want to remind people that because of low voter turnout and the way our electoral system works, the premier was elected with 18% of the population. So 18% of the population voted in a government that has a huge majority of seats in the legislature. So, it may at another time open up some conversations about our electoral system and some things we can do to fix it. But in the here and now, because that we can't change overnight, I think the public has to put pressure on the Ford government. We have seen in the past where the Ford government has backed down when they face intense pressure. And I think one of the reasons they're moving through some of the worst of their proposals in the summer is that people are less politically engaged in the summer, more people are on holiday, maybe people are focused on their final, vacation of the summer or getting the kids ready to go back to school. And so we can't allow like this moment in time in our lives to distract from the fact that we have to politically engage right now and put pressure on this government. I mean, you talked about one of their half-assed solutions is to say, if you're an elder in a hospital and the doctors have decided it's safe for you to be discharged, but there isn't home care available for you, and so maybe you can't be discharged home to home. And if the long-term care home that's nearby you or the few that you've chosen that, hey, these are the places I would like to go to, maybe because it's close to family or quality of care or whatever, the government can say, well, if you're not going to go to there, then we're going to say you have to go to another location. And in some cases, it could be a long ways away from your family. And if you don't go, we're going to start charging you and can charge you up to $1,500 a day. So can you imagine grandma being told, you have to get out, and to just be so callous and just have such a disregard for the well-being and dignity of elders, especially after, what happened in long-term care homes during the pandemic. To me, it's astonishing. And so I say that knowing that one of the ways in which we can help clear space in hospital for people who do have acute care needs is to find places for elders who don't need to be in hospital to be cared for. But in order to do that, you're going to have to make the investments in home and community care so those elders can safely go to their homes and be cared for. Or you have to make sure there are enough high quality long-term care spaces available for those folks close to where they live. And the government hasn't done that. And so now they're using, I would call almost enforced consent or coercion to try to push elders out of hospital to try to clear space for people. And I just don't think that's the kind of Canada most people want to live in. I don't think that's what people think of when they, speak with pride about our healthcare system. And so I would say, you know what? Let's disrupt the status quo by actually investing in public health care and resourcing it in a way that actually helps solving the problems instead of just reaching for the privatization card.
Yeah, I want to note this really quickly, but like this disrupt the status quo thing is something that, especially after George Floyd was murdered, we saw a lot of people of color come around this phrase because we were able to publicly acknowledge that the status quo doesn't work for marginalized communities, not just people of color, but folks who are disabled, folks who are low
Exactly.
income, and so forth. So hearing like there is this intentional co-opting of language that you see
Exactly.
from the far right, and that has all started bleeding together with the far right and the right, where you see language, we saw it around vaccine access and like my body, my choice, like
Yep.
that stuff that's around reproductive rights, where it like makes sense, then they've co-opted those languages. So for people watching, when you hear Doug Ford talk about disrupting the status quo, it's intentional. He's using the words that we use to talk about justice and change to co-opt and like, so that sounds like, oh, that's not bad, like I want to disrupt it, I do want to disrupt it, something has to change. So like yeah, I just like, it's just really sneaky and frustrating to me. And I like, and you're totally right, what we actually need is an investment into our public care system in a way that actually like works, not in a way that's like half-assed and stupid. I saw like a creator talk about how the Conservative Party like offers money, but not where the issue actually is, or doesn't actually address the main issue. But then when they talk about it in the press, they go, "But I gave you money. Like, look,
Mm-hmm.
I gave the money to you." And you're like, "Yes, but I needed money for X, and you gave me money for like an apple, and like I don't need those two things." Um, so yeah, this is all to say that we're seeing him do this. We're seeing this like language change. We know innovative solutions is code for privatizing our public healthcare system. And we know that that also means that marginalized communities, low income folk, are going to be systemically at a disadvantage in this new healthcare system. Um, doesn't this all go against the Canada Health Act?
Yeah, well, it's interesting you say that because one of the things I noticed when the Premier Ford was on the East Coast meeting with Atlantic premiers last week,
Mm-hmm.
they said less about wanting more money from the federal government. And though they did say that, like premiers always say that, so that's like premiers of all political stripes are going to say that. So that's like goes beyond party. But it was interesting. They started talking about the need for innovation, the need for new ways of thinking about the Canada Health Act. And so to me, this seems to be possibly a concerted effort among conservative premiers to start chipping away at the foundations of the Canada Health Act. And so, I don't want to be overly alarmist, but I also don't think
Mm-hmm.
we can be complacent right now, because that's my fear. Is what is happening is a concerted and very strategic effort to undermine public health care in Canada. And, I think one of the things that so many Canadians value, and I think one of the things that just takes stress off of people, especially the most vulnerable and marginal in
Mm-hmm.
our communities, that, I may be struggling to pay the rent and struggling to put food on the table and struggling with so many parts of my life, but at least I know when I need health care, I can access healthcare, and I
Mm-hmm.
can access healthcare in an equitable way. And if we undermine the Canada Health Act, if we undermine publicly funded healthcare, we lose that in our society, and we will be worse for it.
Absolutely. And I think also a lot of the frustrations we have with our healthcare system right now, long wait times, like all this stuff, like it's difficult to see a specialist sometimes. Your primary care physician, is in and out because fee for service model. The solution to this isn't private care. Like everything that we currently have that we're frustrated with has been designed for us to be frustrated with. It's not working. We talk about the system not working for everyone. This is what we mean. Um, so if I want, like, if me, Sam, and like the project and our community wants to see change and progress here, and we think privatization is bad, why would a politician like Ford, or just like maybe let's say vaguely a politician, want to privatize?
Yeah, so I think, some of it's based on ideology. I mean, some politicians think the private sector can deliver better results than the public sector. And I think when it comes to the caring professions, that's not the case. And we saw that in long-term care homes during COVID, where the nonprofit long-term care homes provided better care.
For sure.
I think there are some areas, where the private sector is better. Making smartphones. I don't know if we really want government making smartphones, for example. But when it comes for caring for people, we should always prioritize care over profits. So when it comes to healthcare, when it comes to long-term care, when it comes to mental health care, we need to prioritize and make sure all the dollars that we spend go into caring for people. And one of the first things that happens when privatization happens is that the only way you can have profits out of it is to become, quote, more efficient. And that usually means staff reductions and putting more pressure on staff to work harder, which then oftentimes leads to lower levels of care for people, because those staff are having to care for more people, having to have less time to spend with people, have less time to really understand what their care needs are, maybe to figure out that, that some of the physical needs they have are related to mental health care needs they have. I mean, there's a whole host of ways in which we as people, we're just complicated, right? And you need time to figure that out. Or even just the issue around a lot of nurses have been leaving full-time nursing work because they're underpaid and their wages and benefits are capped at 1%. And they've started working for these private nursing agencies where they can make way more money. It's starting to cost our healthcare system millions of extra dollars. And so not only is that detrimental in terms of having, full-time permanent staff in the system, it starts affecting patient care, because instead of having the same frontline healthcare worker kind of coming in on their shift every day at a predictable time, you get to know them while you're in their care, you start having different people coming in each and every day because they're from an agency and not a full-time permanent staff. And so it's just, to me, another example of how creeping privatization in our healthcare system is undermining the quality of care.
So what can like individuals in Ontario, and also like this answer can probably be expanded across the country, but what can people in Ontario do? Like it's too late to do anything about the fact that, what did you say, only 18% of people voted, or
voted for Doug Ford. So
voted for Doug Ford.
40% of people voted, but only 18% of the entire voting age population voted for the Conservative member of provincial parliament.
Wonderful. That's just wonderful. That's just the worst. So knowing that, like, that's too late. We can't do anything about that.
Can't do anything about that now.
But now we're stuck with this person who wants to take away the healthcare system as we know it. What can we do? Yeah,
so there are organizations that are mobilizing to push back. So the Ontario Health Coalition, various nurses association, especially the Ontario Nurses Association, the Registered Nurses Association of Ontario. So get active in either being a part of a group like the Ontario Health Coalition, which is made up of citizens mobilizing to support public health care, or reach out to an organization like the Ontario Nurses Association, and you can say, hey, I'm not a nurse, but I care deeply about public health care. How can I help you fight for better public health care? So that's a great place to start. Secondly, I would say, like, organize letter writing campaigns, phone calling campaigns, particularly directed at your member of provincial parliament, if that member especially is a Conservative, and to the health minister and to the premier's office and to the long-term care minister's office. I think they need to hear intense public outcry. We've seen a few times, like when they tried to open up the Greenbelt for development, there was huge public pushback, and they backed off on that. When they tried to develop an Amazon warehouse on Duffins Creek wetlands, there was huge public pushback. They backed off. This is going to be an even bigger fight than those, because it's such, you know, such an essential, vital service for the entire province. And in some ways, is, you know, the biggest area of provincial jurisdiction is delivering high quality healthcare. I also think you can reach out to your federal member of parliament and say, enforce the Canada Health Act. Do not allow provinces to chip away at the Canada Health Act through creeping privatization.
So I have a question. Earlier we were talking about, it's really great. We're going to do you have a dog?
My dog is barking. He's been at my feet, but I think another dog walked by.
Oh. You just kept such a straight face as that was happening.
You want to meet my dog?
Yeah, absolutely.
Oh, here, come here. Hey, he'll say hi to you.
Oh my gosh. What's your dog's name?
Helix.
Oh, that's so cute.
Yeah, he's a good little guy.
Okay, wait, hard pivot back. I've taken down notes on what you said around what we can do, and we'll create a post around this to, you know, share with our community. What I want to ask about is, we've been reading, and I feel like, because you work in government, maybe you can't give a direct response to this, but like, what's going on with Mike Harris and his wife and privatization, and how like what's happening? Because that feels like just like a no. It feels like things people shouldn't be allowed to do. So for people watching this, like, my understanding is that Mike Harris, who's formerly had, like, years ago, Doug Ford's job as leader of the Conservative Party and also as premier, he now owns like this large private medical thing. I think his wife owns like a nursing agency, and there's like, and they are directly benefiting from privatizing our healthcare system. Like, it's going right into their pockets.
Yeah, well, I mean, they're certainly benefiting. They're absolutely benefiting from privatization in the healthcare system, in long-term care and nursing agencies in this regard. There's nothing illegal about it.
It's super sketchy.
You can question the ethics of it, but there's sadly nothing illegal about it. And so I think, again, it's just another example of nobody should be profiting from caring for people. Caring for people should be about providing care. And that's why I've always been such a strong supporter. And I say this as somebody who's been, you know, a long time small business owner. Like, I believe that business plays a really important role in our society. And I don't begrudge people making a living by operating a profitable business. But I think when it comes to caring for people in our healthcare system and our long-term care systems, they should be nonprofit, publicly run, publicly delivered, because we should always be prioritizing care over profits.
Absolutely. And I think, like, when I go to, like, if I ever need the hospital, I want to know that what their main focus is getting me better, not like making sure this whole thing is like affordable and that all the things are set up and that they make them $1 at the end of it. Like, that just seems real scary.
Yeah, exactly. Do you mind if I bring up one other issue that doesn't oftentimes get talked about in healthcare discussions, which I think is very relevant to your audience? And that's investing in what people would call the social determinants of health. One of the biggest drivers of health is poverty and homelessness. And if you want to really talk about disrupting the healthcare system in a way that could significantly improve people's health and take pressure off of hospital, it would be to end poverty. And the government could start by doubling social assistance rates, so we don't force people on Ontario Works and Ontario Disability Support to live in legislated poverty. And the second thing they could do is actually build more permanent supportive housing, so that people who don't have a place to, you know, have a roof over their head tonight can have a place to live. And that's why so many doctors have said, you know, I wish we could write a prescription for somebody to get housing, or somebody to get
Yeah.
access to healthy local food, or for somebody to get access to better income. And so if we really want to talk about innovative solutions to addressing the pressures on our healthcare system, let's look at actually things like the social determinants of health, and I would argue the environmental determinants of health, air quality in terms of
Hmm.
people's, respiratory and lung illnesses, the extreme heat we're facing, and the fact that particularly the most vulnerable don't have places to go to cool down, and heat puts incredible stress on people's health. And so there's so many ways in which we could be making investments in ways that would improve people's health, that would also take pressure off of our hospital and healthcare systems.
Absolutely. We're actually doing a bunch of content on the social determinants of health coming up in September. Uh, I think of the social determinants of health as my love language because I so deeply believe that that is what we're supposed to be investing in, and like knowing that there's $1 billion on the table would have been great to put that in there because we're too wealthy as a country and as a province to not be meeting the basic needs of people. It's bigger than just this immediate crisis we're seeing. It's much larger than just shortages and nurses. Not like those have to be addressed, but without the larger picture being addressed and making sure people's needs are being met, making sure people have shelters and homes and like a livable wage, like what are we even doing? What is the point of this?
Yeah,
Um,
exactly. Exactly.
So that is definitely content that we'll be talking about, and I'd love to have you back again when we get to unpacking that to talk about the government's very important role in that and its shortcomings. My last question is for you is sort of a pushback. Like we're talking about how we can disrupt the status quo, and my confusion is like, why isn't there like an alliance being formed between the Greens, the NDP, and the Liberals, or anyone else that's just like what they're doing is wrong? I feel like that publicly shows such a sign of support, and I think for people who maybe didn't vote, who didn't engage, like that's what would pull us in. Um, is seeing like something so different happen, but we're not really seeing that anywhere in our country, and like the responsibility at this point can't just be put on people, like your job and the job of the Liberals and the NDP in Ontario is to work for the people as well. So like, is that possible?
Yeah, that's a great question. And I would say that that's something I work on every day. And most people probably know at Queen's Park, I'm the person who has the reputation of working across party lines to try to
Mm.
collaborate and push back with one voice as much as possible. And I'm going to continue to keep trying to do that because I do think we need coordinated pushback, not only from the public, but from elected officials from all political parties. And I would even say that I can't help but think there are members of even the Conservative caucus who don't support the direction the government is going when it comes to healthcare. And I would invite them to come and work with the opposition parties because healthcare, caring for people, the quality of life for your loved ones. I'm especially thinking of, people's parents and grandparents right now is far too important to allow this crisis to continue and to have the crisis be an excuse for privatization, which I think is
Mm-hmm.
actually going to lead to lower levels of care. And so I would say, yeah, keep putting pressure on people like me and other politicians to work more collaboratively and do it
Mm-hmm.
in a more public way, because I absolutely agree with you that we need more of that in Ontario and across the country.
Okay, well, we will do that. We'll keep
Good.
talking about that.
Awesome. Do.
And I want to thank you so much for being here and for always being accessible to our audience. Like, it's a big deal. We invite a lot of leaders on, not all of them say yes. So it's a big deal to us that you like say that you care about what the people you say that it's important to engage with the community, and then you actually follow through. Like, it's refreshing. So
Well, thank you.
um, thank you so much, and we'll have this up on YouTube and all the fun stuff by the end of the weekend. So if you missed the
Great.
beginning half of this, it's still available, friends.
And
Thanks so
thanks
much.
for letting Helix make make an appearance.
Oh my gosh, best part. Best part, actually. Thank you so much and take care, Mike.
Bye for now. Take care.